All righty. Welcome back to episode number 2 of the overview of physiology and more importantly, pathology here. So we last went over the skeletal systems, functions, and we also went over the pathologies as well as the muscular system with that. So let's go ahead and shimmy on down the list and boom. So our next system here is going to be the lymphatic system. So what exactly is your lymphatic system? What is it composed of? What does it basically do for us? So our lymphatic system is composed of lymphatic vessels, lymphatic structures and organs like your spleen and thymus, as well as lymph fluid, right? So what is lymph fluid? Lymph fluid is essentially the liquid that enters the lymphatic system. So essentially this, what we call interstitial fluid, or the fluid in between tissues and cells, enters into the lymphatic vessels and then travels through the system, being processed and cleaned, and then eventually dumped back into the heart. So lymphatics would include what's called the capillaries. So the capillaries, just like in the cardiovascular system we'll take a look at, are the microscopically tiny little terminal, in this case for the lymph system, not terminal with the cardiovascular system, tiny little vessels of the lymphatic system. So these lymphatic capillaries are really small. They permeate in between all these little spaces of the body, and then travel and get larger and become what's called lymphatic vessels, and then eventually merge through to the larger, what we call trunks and ducts. So the biggest trunks and ducts we see, obviously in the center of the body, or the abdominal and thoracic cavity, we see the left lymphatic duct or trunk, and then the right lymphatic side as well. So also throughout this system, throughout the network, or I call highway of lymphatics, are the lymph nodes. So these lymph nodes, right, you're probably well aware of, are the little bean-shaped structures located throughout the body, right? So typically, your doctor, when you're sick, touches your lymph nodes here. These are your cervical lymph nodes, right? And we have them all throughout the body in larger combinations or quantities, typically at the folds of the body or creases of the body. So like right here, the fold of the armpit would be the axillary nodes. In the inguinal region would be the inguinal nodes, or the ingroinal region, as I like to call it, the groin region. Other major lymphatic structures would include bone marrow. So bone marrow, as we saw in the skeletal system in the previous video, bone marrow actually produces cells. And so one particular type of cell that is produced in the bone are the T cells, right? Or the cells that go to the thymus to mature and become lymphatic cells. So another structure would be your thymus, which is the structure located here, essentially in the throat. And this is where, the T cells we just previously mentioned, they'll mature, they'll develop even further to become, your leukocytes, your white blood cells, essentially. Your spleen is, if you look in the picture there, located basically off adjacent, to the side of your stomach, and kind of right behind the pancreas, right around the pancreas there. And the spleen is a reservoir of both red blood cells and white blood cells, and serves a lot of purpose for when if you're hemorrhaging blood or losing blood, it'll release the blood stored of blood, so you're not losing too much blood. As well as during infection of the body, it can release the white blood cells to go towards the lymph nodes, and which usually causes your lymph nodes to swell is the extra accumulation of fluid and cellular response into the area. So lymphocytes, I've been mentioning them, right? The white blood cells and all that good stuff, right? Lymphocytes are the white blood cells, right? We commonly call these white blood cells those leukocytes, the, the protectors of the body, fighting off infection and everything. So lymphocytes in this case are just, found in the lymphatic system. And there's tons of white blood cells, and we won't get into all the details of them, but for the most part, they're just cleaning and, making sure that our body is nice and healthy. So looking at some of the pathologies of the immune system, our first one here is the HIV and AIDS. So HIV is the human immunovirus, right? AIDS is the acquired immunodeficiency syndrome, which means that, well, one, this is a viral infection of the body. So we're all pretty aware that we contract AIDS from some source, right? And the various sources, obviously kissing not being one of them, but blood transfer, blood contact with infected blood is your go-to method. So the viral infection, gets into the body and targets specifically the white blood cells of the body, more specifically the T cells, the CD4 and CD8 plus T cells. So as the infection grows and becomes worse, and more blood cells are killed off, then it advances into your larger, more threatening condition here. So we measure HIV/AIDS based off of the count of those white blood cells in the body. So at a certain range, we could accurately diagnose that someone would have AIDS based off of how low that white blood cell count is. So it in itself is, nowadays relatively manageable with medicine and everything and so on and so forth, but you can still contract it, and there is no absolute cure. But like I said, it is manageable to where that people can not even be, or what's the word I'm looking for, untransmittable in many cases. But even then, we always want to invoke caution anytime that we have infectious viruses or infection itself present in the massage world. So how do we go about handling HIV/AIDS as a massage therapist? Well, our standards of care and standards of caution come paramount. So one, always making sure that we sanitize and keep things clean and sanitary at all times, right? So making sure that, especially if you do know that your client has HIV/AIDS, taking the necessary precautions to clean and sterilize any instruments that might have bodily fluid on them or come into contact with bodily fluid, and so on and so forth, right? So other precautions would be, if you notice that your client has cuts or anything on the surface of their skin, anything that you could come into contact with their blood, right? Take the caution, use gloves, right? If you have cuts on yourself, cover those up, use gloves as well. So that's something you'd actually probably want to ask your client during the intake, is if they had any cuts or scratches on their body, just so you'd be well aware of ahead of time for when you actually got to that area. And then even then, still just good standard care, washing and sanitizing your hands afterwards would also help. So HIV can actually live in the blood and outside of the body as long as the conditions are well enough. So if that blood sample is just stayed hydrated and healthy, AIDS would live indefinitely. But your regular old rubbing alcohol would actually kill it if it came into contact with it for long enough. So just making sure that you take your standards of care to the high level, just make sure that you clean and sanitize everything that you have that the client comes into contact with, anything you used on them, and so on and so forth. And otherwise, just treat them like a normal person, because they are. Other things to consider too is for people who might have more advanced levels of the condition, their ability to heal and to fight off infection and everything is greatly reduced, and it could make your client a little lethargic. So doing a more vigorous massage style could actually cause them to be a little more, put down in a sense, right? So a little more lethargic in a sense, because you're taxing the reserves that they have. And so, because eventually, as this would advance to the point where your immune system is so weak that, a simple cold or pneumonia usually would kill you. So, keep that in mind too, if the client that you are working with has, an advanced level of this condition, and consider, how you would implement your massage in that regards. The next one is allergies, which I'm sure we're all well aware of, right? What exactly are allergies, right? It's the body creating a response to something that would not normally be something to normally respond to. So, for instance, like a peanut. I love peanuts. They're delicious. I eat them all the time. Some people will just look at a peanut and die. So what happens, right? Well, our immune system just reacts to certain things, in this case, in extreme manners. So sometimes we call these hypersensitivities to these, normal things that the body's immune system just responds inadvertently to, or very aggressively to. So we've probably all experienced or know someone who's experienced the seasonal allergies, those being the common type of allergy, right? And so coming into the allergy season, right, we're all sniffly, wheezy, coughy, puffy faced, whatever, right? Again, sounding all stuffy like that, right? So in the sense of, let's say, common seasonal allergies, well, one, make sure you rule out that it's actual allergies, right? So if it's the dead of winter and trees aren't pollinating and your client's, it's allergies, it might not be allergies. They could be sick. And so you want to take the cautions and care if they had, say, an infectious cold. But still, even if it is full-blown allergy season, your client's all sniffly and coughing, still take those same levels of care, especially if they have discharge from the eyes or nose or anything like that, as that is, hazardous, and we want to sanitize afterwards our massage equipment if that does come into contact with any of their bodily fluids. But otherwise, seasonal allergies are nothing to necessarily worry about. I would suggest that maybe you keep your client face up. As we all know, if we've sat face down on a table long enough, we get all stuffy and puffy and right, just normally, right? So if you're already stuffy and puffy and you're going to double down on that, it's just going to be a very uncomfortable experience. So you might want to consider very limited amounts of time in the prone position. Try to keep them face up, maybe even side lying at best. So other forms of allergies would be, let's say that they came into contact with something that you were using topically, let's say. So an easy example is tree nuts, right? So our oils, our massage, excuse me, oils are derived from nuts, right? And so people who have a nut allergy can react to our massage oils. And so you might actually start noticing that on the surface of the skin, they might start break out in hives. It might get rash it might start getting red and turn into a rash. It might start itching and bothering them. So, if you do notice stuff like that, immediately discontinue the use of whatever lubricant you're using, and opt to something else that's more what we call hypoallergenic, or just the least possibility to cause an allergic reaction. So another common allergy for clients to be allergic to is latex, right? So latex, so if you're using latex gloves, obviously don't use them with a client who's allergic to latex, which is just even more reason why we should just opt to get nitrile gloves, just because they're just as good as latex. They actually don't dissolve with oil, and your clients are least possible to be allergic to the nitrile gloves as opposed to the latex. But otherwise, also make sure that if they're and on your health intake forms, we have a whole section for allergies. Do go over the allergies that they might have, and just even more reason to make sure you understand and know what's in your products, right? What are you using on your client, and what contraindications might you need to take, or considerations might you need to take if a client comes in that's allergic to something you're using, right? How are you going to opt out? How are you going to divert and use something else, right? So if you predominantly use oil, I suggest that you have a backup lubricant to use in these instances. So it's probably very rare that a client would have a full-blown allergic reaction or go into what we call anaphylactic shock, which is where a client someone who might be allergic to, let's say, shellfish, right? And they eat shellfish or something, and all of a sudden their throat starts locking up. The swelling and inflammation in the throat starts to cause the compression on the airways, and they can't breathe. Think like the movie Hitch, right? And he ate the shellfish and was allergic, and he was all puffy, and then later on in the movie he's sipping on Benadryl. In rare cases like that, if they happen to go into anaphylaxis while they're in your massage table and all that, if they're really that allergic to something, they more than likely have what's called an EpiPen. You can give it to them so they can use it, or there's usually instructions onto it, and it's pretty much like inject it into the side of the thigh or glutes, I'm pretty sure. So hopefully you don't have to do that, but like I said, pretty rare, and I've never heard of it happening in the massage realm though, but always good to know. Our next one listed for the immune system is what's called chronic fatigue syndrome. So chronic fatigue syndrome, as the name might sound, chronic, right, is long-term. Fatigue, well, we all know what fatigue is, just being tired and lethargic and out of energy. So this is long-term, just beat down, out of energy, right? So let's go ahead and put that a little bit more into detail. So there is no known cause for chronic fatigue syndrome, but symptoms would be constant lethargy, constant just tiredness, right? And to the tiredness to the point where sleep doesn't make it better, and you're just generally just down, right? Imagine like you've been up for 3 days, you're tired, and it's not changing kind of situation. So lots of speculative possible causes, but some of the causes that we believe could be possible are psychological stress or other physiological stresses in the body. This also goes along with what some people call renal fatigue, adrenal fatigue, I think it's what it's called. Something where the adrenal glands are so overly active that they're just pumping out their stress hormones into the body, causing, just widespread stress in the body to the point where you just crap out, basically. You're so tired of it. But if, let's say, stress and psychological and physiological stress is the causer of chronic fatigue syndrome, well, then massage therapy is right up there to be helpful, right? Just because by nature, we say that massage is very relaxing, right? And so how is massage relaxing, right? So we can use this as a good opportunity to explain that, right? So one, we break it down essentially in as easy as possible into the divisions of the autonomic nervous system, right? So hopefully you're well aware of what's called the sympathetic nervous system and the parasympathetic nervous system. So the sympathetic nervous system, right, we're all probably well aware of as being our fight or flight response system. And then our parasympathetic system being the rest and digest or feed and breathe. So sympathetic, gas pedal, parasympathetic is the brake pedal. And we can essentially associate all of the relaxing benefits of massage to activating or engaging or promoting the activity of the parasympathetic nervous system. So when the parasympathetic nervous system is engaged or activated in the body, it reduces the levels of stress hormones in the body, namely the activity of the adrenal glands, and lowers the levels of blood cortisol in the body, which is known to be a stressor of the body in large quantities, as well as it will slow the heart rate. It will slow and relax the respiratory rate, as well as whenever the parasympathetic system is engaged, our digestive system and digestive motility is increased. And essentially, even our muscles themselves relax and reduce, because in the in the sympathetic activation, we're on edge and alert, and we engage in what's called muscle guarding, right? And that's where our muscles tighten up, right? Because, our muscles technically are parts of the protection that we would go through or utilize, in self-defense. Now, granted, yeah, muscles aren't going to probably stop a whole lot of knives and guns, but hardening your muscles is better than them not being hard. So even in that sense, right, the parasympathetic system, when it's activating, would even reduce the tension and tone of muscles in itself. So, like I said, the sympathetic and parasympathetic division and relationship is a crucial thing to understand as a massage therapist, especially the engagement and activity of the parasympathetic system, because that's where we essentially list almost all the benefits of massage towards, right? So as I said, in reference to chronic fatigue syndrome, if the stress in the body is the root cause of this fatigue, then massage might be something very worthwhile to utilize. Our next pathology is lymphedema and edema. So, in both cases, edema in itself is an accumulation of the lymphatic fluid in an area. So as you can see in this picture, there's different stages and different progressions. And as you can see, progressively, the swelling gets more and more intense. And I believe, fun fact, I guess a doctor told me that you can hold 5 pounds of fluid in your leg, something like that. Said it was a massive amount. And I mean, that stage 4 right there, that seems to be quite a bit of fluid. So what exactly is the difference between lymphedema and edema in itself? Well, lymphedema is caused because of incompetencies of the lymphatic system in itself. So the most easiest example is, for instance, of, women who have, cancer in the lymph nodes, so let's say around the, breast area, they commonly might even have some axillary lymph nodes removed because of that, which then causes the lymph fluid to swell and pool into an arm. So lymphedema in itself is the swelling because of compromised lymphatic structures and setup. Now, massage therapy and lymphedema. In general, massage therapy helps with edema or swelling, right? We can physically move the fluid out of the area and into the lymphatic system. But should we, right? That's the big question. So one, are you even trained in lymphatic drainage? And then two, what is the nature of the swelling? Why is the swelling there? So for instance, of the lymphedema, it might be under a doctor's orders to actually get lymphatic massage. And yes, that would be very beneficial and helpful, because the normal mechanisms that are in place to move lymphatic fluid out of the area are obviously compromised or not being able to do its full function. So then, of course, implementing that external force, massage or whatever else, then can definitely help move the lymph fluid out of the area. So, of course, if this is doctor recommended, then they should have a doctor's note and then, of course, proceed with that. But if they have lymphedema, and especially if they have cancer, which breeds into a whole, different, contraindications and considerations. But if they do have cancer or are going through cancer treatments or so on and so forth, or the lymphedema in itself is pretty advanced, then you might want to make sure that they have clearance from a doctor before proceeding. Other reasons for edema could be tissue damage. So obviously we all know that one of the signs and symptoms of inflammation is swelling. So if there is tissue damage in the area, then, or an injury in the area, inflammation in the area, then what do we do, right? Well, if there's acute injury or inflammation, then it's usually best to just leave it alone and let the process go about itself. And then, later on, if there's still, swelling present in the chronic stages or the subacute stages of the healing process, then, implementing lymphatic drainage may be possible, may be something to consider. But typically, a go-to thing in any instance of acute injury, we just want to leave something alone, right? That's just our best go-to scenario, right? The MBLEX question right there, right? If something's acutely injured or inflamed, just leave it alone, right? And then just use your other knowledge of contraindications that, well, is this contraindication, is this injury something I need to stop the massage for completely or just avoid the area, right? And then you just go based off of that. But unless you're working under a doctor or along with a doctor or whatever, in a chiropractic office, you're not necessarily going to be working the immediate injuries or anything like that. So, it's just in your best interest to let the area heal first. Another form of edema would be pitting edema. I know it's not necessarily listed here, but pitting edema is where, and so all edema, if you press into the swelling, it will leave an indentation. But pitting edema measures how long that impression lasts in the tissue. And the longer that it lasts, the more serious the condition might be or underlying condition might be. So if they do have, advanced pitting edema, that is an absolute contraindication for massage. There could be systemic infection or other issues, and you would want to have them seek medical attention if they haven't already, or get a doctor's note if they are seeking medical attention for the lymphatics. lymphatic drainage. So our next pathology here is lupus, which I'm pretty sure everybody has already heard of. So lupus is what we call an autoimmune disorder or disease. So autoimmune means that your immune system is attacking your body, right? So the structures in your body, which normally should be there, are believed to be foreign, invasive, and should not be there by your immune system, and then it attacks it, right? So lupus itself typically attacks many different structures. You know, it could attack organs and other structures, but one of the most common things that we see lupus attacking is you know, the connective tissue linings, and especially even joints sometimes. That would be more like your rheumatoid arthritis. So lupus itself is manageable, not treatable. So they might be going through what's it called? Infusion therapy to help deregulate the flare-ups. But lupus comes and goes in what's called exacerbations or bouts. And so when lupus is flared up or in an exacerbated state, then it's attacking those structures that it normally attacks, which then, you know, can cause widespread fatigue, you know, possible pain, and so on and so forth. So a go-to general rule is that any systemic being, you know, anything that affects the body as a whole, any systemic pathology that is in a flared up condition is an automatic absolute contraindication for massage. And more than likely, if someone who has lupus is in a flare up, would probably reschedule their massage anyways. But if they happen to come in and you can tell that they're just really beaten down and, you know, just not in the best of the health at that state of time, best to just, you know, reschedule the massage itself. But normally massage therapy outside of exacerbations or flare-ups is fine. And, you know, do be mindful if that lupus or even rheumatoid arthritis is affecting their joints. Be mindful of the movement of the joints. Also be mindful of how vigorous your massage is too, right? If your massage is very taxing on the body, is very stimulatory on the body, and causes the body to essentially react and get shocked, or even induce inflammatory markers, right? That might not be a go-to route. It might not be a way you'd want to practice your massage, especially in regards with someone with lupus. So, you know, being more on the relaxation based end, you know, being more slower, you know, more relaxing, less stimulatory type techniques to be utilized, so on and so forth. All right, so that was the lymphatic system. Now we're moving on to the integumentary system. The integumentary system being your skin. And I do have to say that the skin is one of the most amazing systems of the body, especially in regards to massage, right? Now, I always say that there is essentially a hierarchy of what massage is working for in the body. And first and foremost, it's always the nervous system, right? Because nothing changes or nothing responds in the body without the nervous system basically telling it to or reacting towards what we're doing. And so that nervous system being the main thing we're working for, which would regulate the parasympathetic and sympathetic nervous system, right, is mediated, well, through the skin. Your skin is one gigantic sensory organ, right? All of this skin is sensing the external environment and registering it into your internal environment, right? It registers when there's something creepy crawly on your skin. It measures the temperature, it measures the airflow, it measures a whole bunch of things, right? As we would, if we were to go into deeper, physiology of the system, we would learn about the different receptors. So, I implore you to, take a look at those, as they really help you understand just how we're affecting that nervous system, especially through the medium of touch, right? So, and then of course, outside of that is, the muscular system and fascia. And of course, I say fascia is more important than even muscles, right? Because fascia maintains the integrity and position of the muscles. So in reality, my personal preference of and suggestion of hierarchy of what massage is working for in the body is first and foremost the nervous system, because technically we can stimulate and activate the nervous system without even touching a client, right? This whole ASMR craze, right? I don't know, you eat a bag of chips in someone's ear and it's like, whoa, but whatever. So the nervous system, right? Because we can stimulate the nervous system without even laying our hands on our client. Then, of course, the skin is the medium in which we cause or deliver the change into the body, to the nervous system, to the fascia, to the muscles, and everything after that, right? So, but anyways, let's take a look at the basic functions of the integumentary system. One, it provides protection, right? If you didn't have your skin, that would be quite ghoulish. And I'm playing Diablo 4, and you would look like some kind of creature out of that. And if you don't know what that game is, then whatever, who cares? It's probably a missed reference. But yes, it is a protective mechanism on many fronts. One, it's a barrier. We all know that if we get a cut and something gets into that cut, it can get infected, and that's not a good situation, right? So one, it physically stops dirt, right? If you were to throw dirt at me, it would just flake off my skin. But it also has, on the surface of your skin, you have a microcosmic world of bacteria and all these other things. And you even have specialized cells on the skin that invoke protection and immune response, which I think is probably another listed benefit of the integumentary system. And then, yeah, right there, immunity. Right. So not only is it a barrier protecting us from, physical objects, but it also is protecting us from microorganisms as well that would cause infection. Our skin also absorbs things. It absorbs many things, right? This is one of the main reasons why we put like creams and stuff on our skin, right? We absorb all that good stuff in there. Or the use of, let's say, medicated patches or whatever, right? Our skin can absorb things through it. So, and not only is the listed functions of the integumentary system here just for the system, it's also the properties of what's called epithelial tissue, because the first layer of your skin is epithelial tissue. As I mentioned earlier, it is one gigantic sensory organ. As we said, there are tons and tons and tons of receptors in the skin, in and around the skin, that are constantly monitoring, measuring, and relaying information about all sorts of stuff. Our skin is also basically our AC unit, right? So we talk about what's called thermal regulation, or regulating body temperature, right? We can send blood either to the surface of the skin, right? So you notice on a hot day, right, we start moving and all this, that, and the other, and we're sweating and our skin's flush and our skin's even radiating heat and it's hot to the touch, right? Because we're trying to get heat out of the body the best we can, right? So if we send blood, the hot blood in the core of the body, out to the extremities and out to the surface of the skin where cold air hits it, especially with the sweat on there that's pulling heat away, as well as helping us feel cool when a breeze comes over, right? It's going to make us feel colder. And then vice versa, when it's cold out, well, we stop the blood flow from going to the surface of the skin to keep it towards the core of the body around the vital organs that are more important than, let's say, fingers or toes, which is why we will commonly get frostbite in fingers, toes, nose, whatever first, right? Because we can live without fingers and toes, but we can't live without vital organs. Excretion, now, of course, not poop like that, but sweat, right? In our sweat, there are, little things and nastiness that we sweat out and all that good stuff. So we can eliminate waste through this form of sweat. And then, so along with excretion would also be secretion, which would be like oils. So not only can we excrete waste, but we can also secrete, actual vital substances. And then lastly, our skin can synthesize vitamin D out of sunlight, right? So we all know that vitamin D is something we need, right? Go out in the sun for a few minutes, get a little bit of that synthesization, feeling good, right? So let's take a look at some of the pathologies of the integumentary system. Acne is our first condition up. And we're all very familiar with acne. We've probably had it throughout our life, right? Growing up as a little pimply-headed kid, we are all understanding of acne, and we just got to get them, right? So, one, acne is not a necessary contraindication to massage unless maybe a certain few instances. So, first off, acne is where what's the word? The pore, one of the pores of the body, right, where little pockets basically where, usually like hair or something is found, becomes clogged and with dirt, oil, whatever, and, like pus and stuff starts to grow under it, right? And that's where we get the whiteheads and all that and blah, 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 blah stuff, the nasty stuff, right? So these little clogged pores start to build up, nasty sebum, and then we just pop them, right? So the most common places to really get acne, of course, would be the face, right? The chest, the back, right? So probably not as common for us to work the face massage, but never rule out a good face and scalp massage as a massage therapist. But yes, if they have acne all over their face, pretty easy to avoid that area. If they have a lot of acne on their back, well, taking caution is going to be the best scenario. So the biggest concern with acne is fighting the urge to pop it when you see it. You just want to, no, I'm just kidding. Unless you're me and you're weird like that and you watch Dr. Pimple Popper and, you kind of like mesmerized and you just want to petricide some of those pimples off of them. But don't do that. It's not within our scope of practice. So don't adamantly try to pop your client's pimples. They'll probably hate you and feel weird about you after you do. But if their back is very heavily ridden with acne, it could be uncomfortable to the touch, one. And then two, also screen and make sure there's no broken skin, right? Because we all know when pimples pop, there's broken skin there. And sometimes there's blood, and then of course there's the sebum, and there's the liquid, all that good stuff, right? So if there is broken skin, we need to take caution at any time there is broken skin, no matter what reason there's broken skin, right? So that becomes a local contraindication and we must avoid it. And should it just so happen that when you're working on these areas that have acne, that the acne pops, well, of course, do your best to sanitize the area, clean the area with a towel or something, and just clean your own hands off, and then continue to work elsewhere and avoid that spot, right? Because we wouldn't want to, one, push more nastiness into that area because, one, it's just going to get infected possibly, and then two, it's also a hazard for us to come into contact with their bodily fluids. Going back to the HIV, right? That's one possible avenue to come into contact with blood. So, just, take your caution essentially when it comes to acne. And just try not to make them feel uncomfortable. Like, God damn, oh my God, look at that back. No. Athlete's foot. So athlete's foot, the more technical name is tinea pedis, which is a fungal infection. So this is caused by little spories, little fungal spores that get onto the foot and then proliferate. So we call it athlete's foot because the guy might have taken his shoes off during practice. I walked through some nasty grass that had some fungal spores, and then puts the shoe back on, and the time where he's competing or she's competing and practicing and whatever, and the foot's getting all sweaty and it's nice and warm in there, which is just what fungus loves, right? It loves warm, moist areas and dark, right? Because it's in a shoe. And so then it proliferates and then causes a rash, and an infection on the foot. So it's pretty easy to spot and see. Sometimes it can smell, and if it's really that bad, woo, good luck. So if you do notice, kind of like in this picture here where you have the rough, infected, inflamed areas of the skin there, of course, just avoid the area. That's obvious that is a local contraindication. Do not work athlete's foot. And just make sure that you call my buddy John Madden and get that tough actin tenactin to clear that up. The next one is a boil, kind of similar to a pimple, right? It's usually just a larger accumulation of the sebum and pus. So basically the same cautions and considerations for acne. I guess another thing is that when sometimes boils can group up together, and a group of boils is called a carbuncle. Sounds like a weird uncle. I don't know. Bruises, also known as contusions, right? As we all have experienced bruises before, right? Something hits us, banged us, we bumped into something, whatever, right? And all of a sudden we have the, bruising, the bluish, blackish, purplish color on the skin, right? So, well, what happened? Well, there's tissue damage underneath the skin, right? Broken blood vessels have occurred, and the stagnant blood is pooled and causes the coloration in the area. So what do you do for massage? Well, one, if it's really that bad, and especially that fresh, just avoid the area. If the bruise is actually quite old, because we all know bruises can last for several weeks as they slowly start to shrink up. And a good sign that a bruise is healing is, one, that it's getting smaller. So if you do have a client with bruises, do pay attention to the size and make sure to note in your soap notes roughly about the size. You don't have to pull out a ruler and measure it, but you can kind of maybe even on the side, if you got enough room, try to draw roughly out the size. That way, when you see them in a week or two, did it get smaller or did it get worse, right? Because if the bruise didn't get better or got worse, there's something more wrong, right? They still have bleeding under the skin, or or they have some sort of damaged tissue that isn't healing properly and is continuing to not heal and cause the bruising, right? So in some rare cases, probably not even, I wouldn't even say rare, but in some cases bruising is caused because of sprains and strains. So sometimes pulling a hamstring muscle so bad can cause massive bruising. And I've had plenty of clients and have come in, with running issues with their hamstrings, and I'm talking just like straight purple on the back of their leg. It's intense. It's kind of scary. It's gross, but mesmerizing at the same time. So do pay attention to the healing progression of the bruise. And another thing that you typically say is that if the bruise is yellowing, as you can see in this picture here, the yellowing is usually an indication that there's healing going on as well. So that could be a good thing, a good benefit. But anyways, so if the bruise has been there for a while and healing is taking place, then, you know, working over the area very generally and lightly, you know, shouldn't be a problem. And then of course you can even do something in the ways of lymphatic work, and just essentially working in the direction of blood flow and veins, right? Of course, even hydrotherapy is good, using cold and heat. So there's what we call, I don't know, I call it the chamber lock method. But so you start with, let's say I had a bruise on my forearm right here. Well, I would start with putting cold here and heat here. And this is just general thing, which is going to, actually, I think you start with the heat here, but whatever. Let's say you start with heat here and cold here, which is going to stop the blood from coming into the area and flush the blood from this up, right? Then we swap it. So that way we're pausing the blood from draining out of the area and causing the blood to pool in this area to sort of pick everything up and then just keep flushing it out. So basically you're like chamber locking blood to flow through the area. I try to remember what it was, but what it's called, so you can look it up. But it's one go-to method, or just put the heating pad, cold pack on it and just call it a day kind of situation. Someone's probably going to cancel me for that. Burns on the skin, right? Well, we've all probably burned ourselves at one point in time. We all know that burns themselves can bubble up and pus up. So if the burn is fresh, right, and they do have that bubble, avoid the area. If the burn is, if it's already popped and there's exposed skin, avoid the area. If it's still there, it's just a burn, avoid the area. Pretty much just avoid the area until it's healed and, you know, your client can tolerate you actually working in the area. There are different grades of burns, you know, first, second, third degree, right? And they go up from there. Some burns, as the in you know, more intense injuries, leaves heavy scarring. So some people might have scar tissue in the area from burns long ago, right? So consider that as something you can work with, the scar tissue, you know, if they have any pain or tissue immobilization in the area, right? We might be able to help a little bit. There are some people out there who are teaching massage for scar tissue rehabilitation. So if you wanted to look into that, it's out there. Cold sores, right? A form of herpes, right? The herpes simplex virus. Though not all, I guess, cold sores are considered herpes, but whatever. Needless to say, if you see cold sores on your client, just consider it contagious and viral, right? And standards of care: clean, sanitize the area, all that good stuff. Most people have cold sores on their body, but your immune system usually fights and defends itself to prevent them. So typically they only show up in, you know, when your immune system's taxed or you're just stressed out and stuff like that. But anytime that someone has a cold sore, just avoid working around the face. You know, definitely clean and sanitize the headrest after they've gotten off of the table. And I'd even avoid maybe like some hand work, because, you know, obviously if they touch in their face and stuff, where are they wiping it, right? So their hands. And then from a pathologist I talked to, the most dirtiest part of your body you would think is your hands, but it's actually your forearms. Why? Because, well, people should be washing their hands, and if they are, then your hands are actually going to be quite clean, but most people don't wash their forearms, but they touch them all the time, right? So you're touching you touch that doorknob and you're like rubbing and scratching your forearm, right? You don't wash your forearms, and your forearms are going to have the same bacteria and nastiness that your hands had, right? So, maybe skip out on the arm work if you can, and they don't mind it. Decubitus ulcers, also known as bed sores. Decubitus ulcers are or also known as pressure sores, are where you have, like, let's say you've laid on a spot long enough of your body that blood flow has ceased to the point where necrosis is setting in and tissue is starting to die, and now you're getting sores and dying, decaying tissue. So there's definitely different levels of bed sores, ranging from what just looks like a just kind of red rash on the body, to where tissue is starting to wear away, waste away, and you start to go through layers of the skin, and even worse, in some cases goes all the way down towards muscle tissue or bone. Bed sores aren't something you're really going to see in the massage world unless you're in that type of setting, which would be like hospice care of people who are just like infirm or cannot move, right? So typically in like a medical setting like that, and hopefully if you are, the company is a good company, because that's something that people really monitor and watch out for and try to stop the progression of, just because it's terrible. But if, for instance, or for some reason your client does have bed sores, avoid them, and possibly let them know, or let some staff know if you're working in a medical facility, that this client has bed sores, because they might not know, and that way they can get treated. Eczema is, excuse me. Eczema is our next pathology here. And so eczema looks like a rash, but not necessarily a rash in the sense of a contagious infection or outbreak because of coming into contact with something. Though it could, you could develop eczema because of irritation to the skin from something, but it could just happen because of stress. It could happen because of other things, but it's definitely not contagious and not something you would worry about contracting on yourself. And that's pretty much about it. You would just either avoid the area if it's uncomfortable for the client to work on, especially if there's broken skin. But otherwise, working over the area, as long as there's no broken skin and as long as it's not uncomfortable for your client, you can work over the area. But usually just best to avoid the area if possible. I'd usually get I actually stopped using massage oil because I would get eczema on the base of my fingers because of it. So I stopped using oil. And my thought is that it was just harder to get in those areas and really get the oil out, and oil is just really hard to wash off anyways. So I think like oil would just sometimes get trapped in the deeper folds of the skin, and I don't know, whatever. But yes, and usually starts as like it almost looks like little air bubbles forming under the skin, at least in my case, in cases that I've seen, like air bubbles that form under the skin, and they're super itchy, and then eventually it's like they just pop, and then like the skin's not necessarily broken, but it's just peeling. Like the first layer of skin is just shedding off. It's crazy. Impetigo is our next condition, and impetigo, again, not a condition you'd probably really see as a massage therapist. Impetigo is a condition that most commonly affects children and infants. It is a bacterial infection that happens around the mouth, which causes essentially like blisters and sores around the mouth. And then those blisters and sores, when they pop, dry up into the what's called the honey crust colored depiction, as you're seeing here and on this child. Impetigo is very contagious amongst children, and adults too, if you come into contact with it. So if someone has impetigo, just avoid the massage, especially in the area. But I'd probably just we could just postpone the whole thing, buddy, get out of here. But like I said, very uncommon to really see, as it's most common with children. But lice, we all know about lice. Hopefully you never had lice. I never had lice, so I don't know how terrible it is, but definitely something you can easily contract, right? So the little larvae and eggs and everything can get on some other surfaces and get onto other objects, and then the objects get into your hair, and then the lice infects the hair, and then you got itchiness, and then you can either shave your head bald, I guess, or you wash with a special shampoo. So if you do notice that your client's scalp is crawling or they're itching a lot, then you should probably really make sure to sanitize up your room very, very thoroughly, and then make sure they don't come back until they are free of lice. Now, of course, if you know ahead of time that your client has a lice infestation on their head, go ahead and reschedule them. But otherwise, just keep it clean, keep it sanitary. Psoriasis is our next skin condition. Psoriasis is the proliferation of skin in a faster quantity. So we all know that skin rejuvenates and rebuilds itself. Well, psoriasis is where that happens at a much faster rate, which then leads to the dry, flaky, scratchy, scaly patches of skin. Most commonly around maybe like the hands, elbows, shoulders, arms and stuff like that. So what do we do with massages considerations? Well, one, they could be rather conscientious of it, so we'd want to avoid it so that we don't make them feel awkward about it. Two, it could be uncomfortable to work the area, so that's another reason we'd want to avoid this area as well. Three, it could be proliferating and intense to the point where there is broken skin, which is another reason why we'd want to avoid the area. So in pretty much every case, if there's major instances of psoriasis and dry flaking skin like that, just avoid the area at best. Unless it's very mild and then your client is okay with you to work on the area, then maybe you can do a little light work of the area briefly. But again, just do your best to avoid the massage in that area. Ringworm. So ringworm, is it Tinea colis? I think it was the technical name, just like our athlete's foot was Tinea pedis. And so in this case, ringworm is Tinea colis. I might have to look it up for you real quick. I can't remember off the top of my head. But ringworm is a fungal infection, very similar to the athlete's foot, though it's just a different type of fungus. I can't find it. Oh, well. Try to find the technical name, whatever, wasting time. So Again, another fungal infection, but causes a circular ring in the area. Kind of looks like that, like suckerfish, little lamprey, just sucks on you, causing that little red ring patch. So if you do notice a red ring on your client, especially, usually like the arms or anything like that, legs even, avoid the area. And yeah, just let them know probably too. So this usually comes from playgrounds. The most common places would be like catching it at a playground. So usually children get this quite often, and they go to the playground, and things like to use playgrounds as a bathroom, like dogs and especially cats, right? They poop and pee in the playground, and then it's a warm, moist night, and the fungal spores start to proliferate in the area. Kid goes, plays, and they get ringworm. Ringworm is contagious, so do your best to avoid the area. Scabies is our next condition. Scabies are little what we call mites that burrow underneath the skin, and very irritating, very ouchy, very itchy, and treatable with a medicated cream to get them out of the area. But they are also contagious too. So if you do notice instances of scabies, which kind of looks like they kind of tunnel burrow under the skin, you see like red patchy areas of skin, especially with like an entry point as well. Do your best to avoid the area. So these are what we call pathological animals, infection by like infectious like animals, or I can't remember the exact term there, but same thing with lice, right? Little pathogenic animals. They are on the surface or underneath the surface of the skin, and they are contagious. So do avoid these scabies. I think a similar, in the same family of scabies, I think what we call them here are the chiggers, right? So they tell you here in Florida, don't pick up the Spanish moss because there could be chiggers in there, which I don't know if there's another technical term for that, but those are another similar family of burrowing mites that go under the skin. So do avoid both, I guess, touching Spanish moss in your life, that's on the ground at least, and also avoid your client who might have scabies. Scars. So scars are where the skin tissue has been broken and has been replaced with fibrous connective tissue. So we all know what scars look like. We all understand how we can get scars, right? From cuts and other wounds in the area, right? And so when the skin heals, right, connective tissue is replacing the lost other tissues, and then leads to that scar tissue effect. So scar tissue, of course, right, we can rabbit hole into a little bit, where scar tissue has the possibility to form adhesions, which means that it can essentially stick to other tissues and then cause restrictions in the movement of those tissues as they would slide past or around each other. So what do we do for scars? What are the things to consider about scars? Well, massage therapy itself is, well, good for scar tissue in a sense, because we can do massage that would help to promote the healthy development of scar tissue, right? One of our go-to considered techniques is the transverse friction, right? Sometimes we call that the deep transverse friction, the Seborrheic friction, right? But essentially friction in the area to cause a localized therapeutic inflammation can reform the tissue, because scar tissue itself, being composed of collagen mostly and reticulin connective tissue, has certain properties to it. When you go into and looking at the science of connective tissue, we see one of the properties in particular is thixotrophy, which is the ability of connective tissue to go from a solid state to a more liquidized state to be reformed. So essentially we can, kind of break it down, liquefy it to, one, reduce the adhesions, reduce the limitations in mobility, and then allow it to rebuild itself in a more healthier manner. So scar tissues and scars, again, not necessarily something we would consider a contraindication to massage, but definitely something we could help and deal with. Our next condition up here is, well, in this case, seborrheic dermatitis, but we'll look at just dermatitis by itself, and then, briefly what seborrheic dermatitis is. So seborrheic dermatitis, also known as, for children, what we call cradle cap, right? Where they get the dry, flaky skin, irritated skin on the scalp, right? So this is proliferation and inflammation of like a rash on the skin, especially seborrheic dermatitis, talking about the scalp, right? Giving you that dandruff. But dermatitis itself, derm, skin, itis, right, is inflammation of the skin. There's many different causes of dermatitis. You could have, a viral dermatitis, right? So, you could, contract something, right? Like a bacteria or something gets on the skin, right? Causes dermatitis, right? Causes the skin to flare up and react, causing a rash. Other instances would be like you could come into contact with like poison ivy or something like that. Other instances too is the body having like an allergic reaction to something. So maybe, ladies sometimes might use a certain skincare product and you notice it made your skin, have a rash or whatever, right? That's dermatitis. We call that contact dermatitis, right? Causes the outbreak on the skin, causes the rash on the skin. So in all cases, pretty much of dermatitis, something also similar to the eczema, but dermatitis we usually consider to be more contagious, right? You can contract dermatitis in some instances. But anyways, we would want to avoid working in the inflamed area of skin. Our next one is shingles. So shingles is the reactivation of the chickenpox virus. Well, you would get shingles because you had chickenpox before in your life, because the chickenpox virus actually lies dormant within the nervous system, in this central nervous system. And then when the immune system is weakened and compromised, especially, usually in older age, it can break out and follows along what's called a dermatome, or follows along the pathway of the nerve. So that's why you see, like in this picture, it goes along the ribs like that, because the nerves like come out from the spine like this. So they follow the nerve pathway, and it causes, kind of like this lightning scar kind of thing, it's got the blisters and inflamed skin and all that stuff. And it is quite contagious too, as well, especially if you've never had the chickenpox virus before. So, if, client does come in and they seem to have shingles, absolute contraindication, postpone that massage, and proceed from there. Stretch marks. So stretch marks, kind of similar to scar tissue, right? But where the skin has grown so fast that it didn't have time to grow with, or excuse me, to reform itself and expand with that growth, causes it to become weak and brittle at points. And essentially like stretched out. Think like you're stretching out a piece of plastic and it just starts getting weak in certain areas. Same thing, same essential thing. So obviously the most common cases to find stretch marks are, pregnant women. Other instances too would be like people who gain a lot of weight really fast, especially certain skin types. They don't replenish their skin cells as quickly as others. So usually and it's also just that certain skin types just it might be more noticeable too, but typically like darker pigmented skin usually is a lot slower to reform and develop, so easier to get scarring tissue, keloid scars, stuff like that. But any instance of expansion of the skin, rapid expansion of the skin, can cause the scar stretch marks, and there's pretty much nothing to really do about it. Massage can work over the area, and there's nothing to worry about. And yeah. Obviously, if the client is still currently pregnant, then that breeds in, other slew of considerations and contraindications. But other than that, warts should be our last integumentary system pathology, skin pathology, and also we'll call it here for the night. Warts are the grainy growths typically found on the fingers, hands, toes, feet, but could be found in other places as well. So warts are contagious, so do your best to avoid them. And if you do come into contact with them, definitely clean and sanitize your hands, and clean and sanitize anything and equipment in the room. Otherwise, warts regularly treatable. Usually you can go to the local pharmacy and you get a kit that freezes the thing off of you. But other than that, just make sure to try to avoid working on a wart. And so then we would get into the nervous system's pathologies, and we'll save that for next week. So I think that's a good stopping point. Just to recap, we went over the integumentary systems pathologies. We went over the lymphatic systems pathologies and function as well. So, hopefully we able to cover a lot and give you good information. So we'll stop the recording and then open the floor to any questions.